Narrator procedural sedation, also known as conscious sedation, is used to provide sedation and analgesia during medical procedures while allowing patients to maintain spontaneous respiration and protective airway reflexes. Today, I'll walk you through the critical aspects of administering procedural sedation safely and effectively. Let's start with patient assessment and selection. Pre-sedation assessment involves gathering a comprehensive medical history, including any history of anesthesia reactions, current medications, allergies, and comorbidities. For example, a patient with obstructive sleep apnea may require special considerations regarding airway management during sedation. Perform a thorough physical examination focusing on the airway, cardiovascular status, and any potential contraindications for sedation. Assessing a patient's airway for any anatomical abnormalities that could complicate ventilation is essential. Risk stratification is crucial. Utilize the American Society of Anesthesiologists (ASA) classification system to evaluate the patient's physical status. For example, an ASA Class II patient who has mild systemic disease may be suitable for procedural sedation, while an ASA Class IV patient with severe systemic disease may require more careful consideration. Now let's talk about informed consent. Explain the procedure and sedation to the patient. Clearly describe the procedure being performed, the purpose of sedation, and the expected outcomes. For example, explain to a patient undergoing a colonoscopy that sedation will help them remain comfortable and relaxed, but there are risks such as respiratory depression and allergic reactions. Obtain written consent after discussing all relevant information. Next, monitoring and equipment. Prepare monitoring equipment before the procedure. Ensure all necessary devices like pulse oximeters, blood pressure monitors, and ECGs are ready and functioning. Also, have resuscitation equipment available, including oxygen suction devices and emergency medications like flumazenil for benzodiazepines. Continuous monitoring of vital signs is critical. Monitor heart rate, blood pressure, oxygen saturation, and respiratory rate throughout the procedure. Moving on to the administration of sedation. Choose appropriate sedative agents based on the procedure, patient history, and level of sedation required. For example, midazolam may be used for its anxiolytic properties, while fentanyl can be added for pain relief during a painful procedure. Start with an initial dose of sedative medication based on patient weight, age, and overall health status. Titrate carefully. For instance, start with a low dose of midazolam, around 1 to 2 milligrams, and adjust based on the patient's response. Post-procedure care is the final step. Monitor patients in a recovery area post-sedation until they meet discharge criteria, including stable vital signs, appropriate alertness, and ability to protect their airway. Provide patients and caregivers with clear post-procedure instructions regarding recovery, activity restrictions, and signs of complications. Lastly, ensure comprehensive documentation. Document all aspects of the sedation process, including the pre-sedation assessment, medication administration, vital signs monitoring, and post-procedure observations. Adhering to these guidelines for the administration of procedural sedation is essential to ensure patient safety and comfort. By following a structured approach that includes thorough assessment, informed consent, careful monitoring, and post-procedural care, healthcare providers can minimize risks and enhance the overall patient experience during sedation. Thanks for watching. Remember to like, subscribe, and hit the bell icon for more informative content.